Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's focus on some sexually transmitted diseases. Sexually transmitted diseases. So here in sexually transmitted diseases, the first disease we are going to look at will be the genital herpes. So this genital herpes, it is caused by the herpes simplex virus. And that is, it includes the herpes simplex virus 1 and also 2. So what are the appearance? It appears as blisters. That is, it is usually multiple, and it leads to the ulcer formation on breaking. Next is these ulcers, they are painful. Next, looking at the granuloma inguine, we are looking at granuloma inguine. So granuloma inguine or the donovenosis, it is caused by Klebsiella granuloma. So this is caused by the Klebsiella granuloma. It is formerly known as the Calm Matobacterium granulomatis. So what are the features of this? So it is usually causes beefy red genital ulcers. So this beefy red genital ulcers, it's important. Next, it is also the ulcers are usually painless. Painless ulcers, and lymphadenopathy is usually absent, but subcutaneous granulomas are causes pseudobulbous. So there is subcutaneous granuloma. The subcutaneous granulomas, they cause pseudobulbous. Next, let's look at the microscopy. So upon the microscopy, what is seen? So upon microscopy, it shows the Donovan bodies. So granuloma inguine or donovenosis. So it shows the Donovan bodies, and this with a closed safety pin appearance. So it has a closed safety pin appearance. Next, we move on to the chancroid. The chancroid is also known as the soft chancre. So the chancroid or soft chancre is caused by the HD. HD stands for the Haemophilus ducreyi. And what are the causes? So the causes genital ulcers that are non-indurated. Ulcers are non-indurated ulcers, and they have undetermined edges. Next is these ulcers, they are very painful. Ulcers are painful. It includes multiple kissing ulcers developed in the auto-inoculation from the primary ulcers. So they contain multiple kissing ulcers. So it contains multiple kissing ulcers. It develops from the auto-inoculation from the primary ulcers of the primary ulcer. Next is, it usually causes the tender unilateral inguinal pubes. It causes tender unilateral inguinal buboes. So chancroid, it is they are non-indurated with undetermined edges. The ulcers are usually painful in case of chancroid, and the multiple kissing ulcers develop due to the autoinoculation of the primary ulcers. It is usually caused by the tender unilateral inguinal buboes. And what happens in the microscopy? Upon microscopy, the chancroid forms a school of fish. It causes a school of fish as well as a railroad track appearance. The next is syphilitic chancre. So syphilitic chancre is also known as a heart chancre. So syphilitic chancre or heart chancre, it causes a treponema pallidum. So syphilitic chancre, it is caused by the treponema pallidum. So how does this treponema pallidum, how does this syphilitic chancre present? So presentation, it presents as a small button-like. It is small, it is button-like, and it is an indurated ulcer. It is a small, it is button-like and indurated ulcer, and it is usually round and it is also oval. Next is what we need to know is the syphilitic chancre is painless, and it causes the painless lymphadenopathy. Painless lymphadenopathy, and on microscopy there is a spirochetes are seen on dark illumination. Spirochetes on dark illumination. Next we move on to the lymphogranuloma venerum. So this lymphogranuloma venerum, it is caused by Chlamydia trachomatis. And it is usually present with the transient single shallow ulcer. So there is a transient single shallow ulcer. So transient single shallow ulcer, it heals rapidly, and it usually goes unnoticed. And the secondary stage presents with tender inguinal buboes. Secondary stage presence is tender inguinal buboes. Next we move on to the groove sign. So this groove sign is seen when the lymph node above and the below the inguinal ligament are enlarged, leading to the appearance of a groove. So since we are considering this as the inguinal ligament, the lymph node above and below, they are enlarged, leading to the appearance of a groove. So they become enlarged, leading to the appearance of a groove. Next we look at the gonorrhea. So this gonorrhea is caused by the Neisseria gonorrhea, as the name suggests, and it leads to the purulent inflammation. There is a purulent inflammation of the genital mucous membranes of the genital mucous membranes. And how does the gonorrhea present? So this gonorrhea, it presents as urethritis. Next, there can be cervicitis, there can be epidermo-orchitis, as well as the PID stands for the pelvic inflammatory disease. So the usual presentation is it includes acute urethritis, and they are with complaints of burning dysuria. There is burning, dysuria, as well as purulent discharge, channel.